Welcome to Bugs and Beyond, your one-stop shop for all things infectious diseases.
That's right.
You know, before we get started with the fascinating world of microbes, I think we should take a moment
Oh, yeah?
to show some appreciation for all those good bacteria out there.
Right.
I mean, after all, we wouldn't have yogurt and cheese and even a happy gut without them.
Absolutely.
So to all the beneficial bacteria out there, we salute you.
Yes.
Now, today we are taking a deep dive into vancomycin, a powerful antibiotic that's been around for quite a while and is really a cornerstone of treatment for serious infections.
It's pretty amazing. It's fascinating how just a little soil sample from Borneo led to such an important medication.
Right.
Vancomycin has really revolutionized the way that we can treat gram-positive bacterial infections.
And, it's amazing, that origin story. Vancomycin was isolated from Streptomyces orientalis.
Yeah.
Found in, wait for it, mud. Who knew that mud held the key to fighting some of the toughest infections?
I know.
And I love how the name vancomycin itself comes from vanquish.
Yeah.
It's like this superhero of the antibiotic world.
It really is. It really does live up to that name. The way vancomycin works, the mechanism of action is kind of like this microscopic demolition crew.
Okay.
It really targets the construction of that bacterial cell wall, specifically by binding to the dealanine precursor, and it prevents the wall from being formed properly.
So imagine trying to build a house without bricks.
Yeah.
That's basically what vancomycin does to bacteria.
Right.
It leaves them vulnerable and unable to really survive.
Yeah.
Now, it's not always a kill-all situation, right? Sometimes it just stops them from multiplying.
That's right. Vancomycin can be bactericidal, so it actually kills the bacteria.
Right.
Or it can be bacteriostatic, meaning it just stops them from growing. And it just depends on the specific bacteria that it's targeting and the concentration of the drug. But either way, it really disrupts their ability to thrive.
Now, let's talk about its target audience. We know it's great against gram-positive bacteria.
Yeah.
Those with the thicker cell walls.
Right.
But it's not a magic bullet for everything.
So it's not. Vancomycin mainly works against those gram-positive bacteria.
Okay.
So think of it like a key that fits a specific lock,
Right.
It's particularly effective against a whole range of bacteria, including C. difficile, which can cause some pretty serious and sometimes life-threatening infections.
Right. And we actually have a chart here.
We do.
That shows its spectrum of activity. It's impressive how many gram-positive troublemakers vancomycin can tackle.
Yes.
But let's take a step back and consider how vancomycin actually journeys through the body.
Okay.
The pharmacokinetics, it's like tracking this adventure from the moment it enters the bloodstream.
That's a really great way to put it.
Yeah.
Understanding those pharmacokinetics, how the body absorbs it, distributes it, metabolizes it, and eliminates a drug, that is crucial for us to determine the appropriate dosage and to make sure that it's both effective and safe.
Absolutely. So looking at the chart here, we can see that vancomycin is usually given intravenously, straight into the bloodstream.
Yeah.
And its bioavailability is pretty low.
Yeah.
Meaning it doesn't really absorb well when it's taken orally. It has a half-life of 4 to 6 hours.
Yeah.
Meaning it takes that long for the body to eliminate half the dose.
Yes.
So kind of like how your coffee buzz gradually fades over time.
Exactly.
And it has a volume of distribution of 0.65 to 0.85 liters per kilogram.
All right.
Which basically tells us how widely it spreads throughout the body.
Yeah.
Most of it is eliminated through the kidneys, and about 55% is bound to proteins in the blood, which of course can influence how it interacts with other medications.
Right.
All of these factors play a role in determining the right dose for each patient.
Absolutely.
Speaking of dosing, it's interesting how it's calculated based on actual body weight.
Yeah.
Not ideal body weight.
Right.
And for critically ill patients, we often use a loading dose like the supercharge to get those therapeutic levels up quickly.
Exactly. We want to make sure there's enough of the drug in the body to really fight that infection effectively.
Yeah.
But not too much that it could cause harm.
Right.
And that brings us to this very crucial aspect of monitoring vancomycin levels.
Okay.
Particularly something called trough levels.
Trough levels, the lowest point of the drug's concentration in the blood.
Yes.
Right before the next dose.
Exactly.
So pop quiz time.
Okay.
What is the goal trough level for vancomycin?
Right.
Is it A, 5 to 10 millisieverts/ml,
Okay.
B, 10 to 20 millisieverts/ml,
Okay.
or C, 20 to 30 millisieverts/ml?
All right.
Take a moment. Ponder.
Think about it.
Channel your inner vancomycin knowledge.
Remember, we're looking for that sweet spot, potent enough to fight the bacteria,
Yeah.
but not so high that it could lead to those unwanted side effects.
Right.
So keep that in mind.
Okay, time's up.
Okay.
The answer is B, 10 to 20 mcg/mL.
That's right.
We aim for this range to make sure that the drug is doing its job effectively
Yes.
while minimizing the risk of things like kidney damage.
Exactly. It is a delicate balance, but sometimes we go even deeper,
Okay.
looking at the AUC-MIC.
Right.
So that's the area under the curve over the minimum inhibitory concentration.
Okay.
So imagine you're studying for an exam, right? That AUC is like the total time you spend studying.
Right.
And the MIC is like how difficult that exam is.
Okay.
So you need enough study time,
Yeah.
that AUC, to
Yeah.
pass an exam of a certain difficulty,
Yeah.
which is your MIC.
I like that analogy.
Yeah.
So in the case of vancomycin, we want enough drug exposure over time,
Yeah.
AUC,
Yeah.
to overcome that bacteria's resistance level, the MIC.
Exactly.
Now, while vancomycin is a true workhorse in the world of antibiotics,
Oh, yeah.
like any medication, it's not without its quirks.
That's right.
Potential side effects that we need to be aware of.
Yes, definitely.
And it's important to be mindful of those. To help us remember, I came up with this mnemonic
Okay.
VAN-ROT
Okay.
for vancomycin. Allergies, nephrotoxicity, red man syndrome, ototoxicity, and thrombophlebitis.
That's great. That's handy.
So that's a mouthful,
Yeah.
but that mnemonic definitely helps.
Yeah. And speaking of red man syndrome,
Yeah.
that's a reaction that can happen if vancomycin is infused too quickly.
Oh, okay.
It's not as scary as it sounds. It just mainly causes flushing, redness, and itching.
Oh, okay.
But we can avoid that by making sure we have a slow and steady infusion rate.
Good to know. And while vancomycin is generally a good mixer in terms of drug interactions,
Yes, it has relatively few drug interactions. Unlike some medications that might clash, vancomycin seems to get along well with most of the others.
it's like that easygoing friend everyone loves at a party.
Exactly. But we still need to be mindful of potential interaction,
Right.
particularly with drugs that can also affect the kidneys or hearing.
Right, yeah.
It's always best to be cautious and talk to your healthcare provider
Yeah.
about all the medications you're taking. Now, on a more serious note, let's talk about that elephant in the room when it comes to antibiotics.
Okay.
The challenge of resistance.
Right.
That is a constant battle against evolution, unfortunately.
Right.
Bacteria are so incredibly adaptable.
Yeah.
And some have actually developed ways to resist the effects of vancomycin,
Right.
which is a serious concern.
Like they're putting on microscopic armor
Yes.
to deflect our antibiotic attack.
Exactly.
So how do they do it? What's their secret?
Well, one of the key players in this whole resistance drama is a gene called VAN-A.
Okay.
And this gene actually changes the structure of the bacteria's cell wall,
Uh-huh.
making it much harder for that vancomycin to bind and do its job.
Oh, okay.
So think of it like changing the lock on a door so the key no longer fits.
So the bacteria are essentially outsmarting the vancomycin, making it ineffective.
Right.
That's troubling. And I've heard of these superbugs, VRE and VRSA. They sound pretty intimidating.
They are.
Yeah.
VRE stands for vancomycin-resistant Enterococcus,
Okay.
and VRSA is vancomycin-resistant Staphylococcus aureus.
Okay.
These resistant strains pose a big challenge in healthcare settings
Yeah.
because they can cause infections that are much harder to treat.
Right. It highlights how crucial it is to use vancomycin responsibly
Absolutely.
and only when it's absolutely necessary.
Yes.
Overuse can fuel the development of resistance, which will limit our treatment options in the future.
Exactly.
Now, let's shift gears a bit and explore the practical side of things.
Mm-hmm.
When is vancomycin actually used?
Okay.
What kind of infections does it tackle in the real world?
Well, vancomycin is a versatile tool in our arsenal.
Okay.
It's often a first-line treatment for serious infections like skin and soft tissue infections, bacteremia, which is when bacteria enter the bloodstream, and endocarditis, an infection of the heart valves.
Uh-huh.
It's also used for meningitis, an infection of the membranes surrounding the brain and spinal cord, osteomyelitis, an infection of the bone,
Wow.
and pneumonia, an infection of the lungs.
Wow. That's quite a range.
It is.
It really is a frontline warrior against some serious conditions.
Yes, it is. But it's important to remember that vancomycin is a powerful antibiotic,
Uh-huh.
and it should be used judiciously to preserve its effectiveness for as long as possible.
Absolutely. Before we move on, let's take a moment to recap what we've learned so far about vancomycin.
Okay.
We started with that incredible origin story,
Yeah.
from humble mud to a microbe-vanquishing champion.
That's right, from mud. And then we delved into this fascinating mechanism of action, how it acts like this microscopic demolition crew,
Right.
dismantling those bacterial cell walls.
And we explored its target audience, primarily those tough gram-positive bacteria,
Yes.
and looked at that spectrum of activity. We also took a journey through the world of pharmacokinetics, understanding how vancomycin travels through the body, how long it stays around,
Right.
and the importance of getting that dosage just right.
And, of course, we can't forget our pop quiz about those trough levels,
Yes.
highlighting how monitoring those levels is key to striking that balance between effectiveness and safety.
Exactly.
And we even ventured into that more nuanced realm of AUCMIC,
Right.
ensuring enough drug exposure over time to overcome that bacterial resistance. And who could forget our handy mnemonic, VAN-ROT,
Right.
to remember those potential side effects?
Allergies, nephrotoxicity, red man syndrome, ototoxicity, and thrombophlebitis. It's a mouthful, but that mnemonic certainly helps.
It does. And speaking of red man syndrome, we learned that slow and steady infusion is key to avoiding that reaction.
Absolutely.
We also touched on drug interactions, highlighting that vancomycin is generally a good mixer, getting along with most other medications.
Like that friendly neighbor everyone loves.
Exactly. But then we faced the looming challenge of antibiotic resistance and those superbugs, VRE and VRSA, that have learned to outsmart vancomycin.
Right.
It's a sobering reminder that the fight against bacteria is an ongoing one.
Absolutely.
Yeah.
And finally, we explored the real-world clinical uses of vancomycin, seeing how it's used to tackle a wide range of serious infections.
That's right.
From skin infections to pneumonia, vancomycin is a valuable tool in the fight against those bacterial invaders.
Yes, it is.
Okay. Ready for the final part of our vancomycin journey?
Absolutely. Let's dive in. It's really a constant battle against evolution. Unfortunately, bacteria are so incredibly adaptable.
Yeah.
And some of them, they've developed ways to resist those effects of vancomycin.
Right.
And that's a serious concern.
It's like they're putting on microscopic armor to deflect our antibiotic attacks.
Exactly.
So how do they do it? What's the secret?
Well, one of the key players in this resistance drama is a gene called VAN-A. And what that gene does is it actually changes the structure of the bacteria's cell wall. It makes it a lot harder for that vancomycin to bind and do what it's supposed to do.
So it's kind of like changing the lock on the door so the key doesn't fit anymore.
Exactly.
So those bacteria are essentially outsmarting the vancomycin.
Right.
They're making it ineffective.
Yeah.
That's troubling.
It is.
I've heard of these superbugs, VRE and VRSA.
Yeah.
They sound pretty intimidating.
They are. VRE stands for Vancomycin-resistant Enterococcus.
Okay.
And VRSA is Vancomycin-resistant Staphylococcus aureus.
Okay.
And these resistant strains, they're a big problem, especially in healthcare settings.
Yeah.
Because they can cause those infections that are much harder to treat.
And it just really highlights how crucial it is that we use vancomycin responsibly.
Absolutely.
And only when it's absolutely necessary.
Yes.
Overuse of these antibiotics is what fuels that development of resistance and limits our options in the future.
Exactly.
Now, let's shift gears a little bit and explore the practical side of vancomycin.
All right.
So when is it actually used? What kind of infections does it actually target in the real world?
Well, vancomycin is a very versatile tool that we have.
Right.
It's often a first-line treatment for those serious infections like skin and soft tissue infections, bacteremia, which is when those bacteria enter the bloodstream,
Wow.
endocarditis, infection of the heart valves. It's also used for meningitis, infection of the membranes that surround your brain and spinal cord.
Wow.
Osteomyelitis, an infection of the bone, and pneumonia, infection of the lungs.
That's quite a range.
It is.
It really is a frontline warrior against some serious conditions.
Yes, it is. But it's really important to remember that vancomycin is a very powerful antibiotic.
Right.
And it should be used carefully, judiciously, to try and preserve its effectiveness for as long as possible.
Absolutely.
Yeah.
Okay, before we move on, I think it's a good idea to take a moment to recap what we've learned so far. We started with vancomycin's origin story.
Yeah.
From humble mud to a microbe-vanquishing champion.
It's in the mud. And then we delved into the mechanism of action,
Right.
how it acts like a microscopic demolition crew, dismantling those bacterial cell walls.
We also explored its target audience, primarily those tough gram-positive bacteria,
Yes.
and looked at the spectrum of activity.
Yeah.
We took a journey through the pharmacokinetics, understanding how it travels through the body,
Right.
how long it sticks around, and the importance of getting the dosage just right.
Yeah. And we can't forget our little pop quiz on those trough levels,
Right.
Highlighting how important it is to monitor those levels, to strike that balance between effectiveness and safety.
Absolutely.
And we even went into that more nuanced realm of IUCMIC,
Yeah.
ensuring enough drug exposure over time to really overcome that bacterial resistance.
Right.
And who could forget our handy mnemonic VAN-ROT for all those potential side effects?
Allergies, nephrotoxicity, red man syndrome, ototoxicity, thrombophlebitis.
It is a mouthful, but I think it helps.
It does. It does. And speaking of red man syndrome, we learned that slow and steady infusion is really key to avoiding that reaction.
Absolutely. We also talked about the drug interactions, highlighting that vancomycin really is a good mixer.
Yeah.
It gets along well with most other medications.
And a friendly neighbor.
Exactly. But then we face that looming challenge of antibiotic resistance.
Right.
And those superbugs, VRE and VRSA, that have learned how to outsmart vancomycin.
Right.
It's a sobering reminder that this fight against bacteria is ongoing.
Absolutely. And finally, we explored the real-world clinical uses of vancomycin.
Yeah.
Seeing how it's used to tackle such a wide range of those serious infections.
That's right.
From skin infections to pneumonia, vancomycin is a valuable tool in the fight against those bacterial invaders.
Is.
Okay, ready for the final part of our vancomycin journey?
Absolutely. Let's dive in. It's been quite a journey, hasn't it? Exploring the ins and outs of this powerful antibiotic.
It really has. We've covered so much.
Yeah. From those humble beginnings,
Right, in the mud.
To its role as this frontline warrior against some really serious infections. We've delved into how it works, its pharmacokinetic profile, its strengths and limitations. And of course, we face that reality of antibiotic resistance, which is a challenge that really underscores the importance of using antibiotics responsibly and the need for continuing research and innovation.
It's like this constant race against the clock with these evolving microbes, always trying to stay one step ahead.
One step ahead, yeah.
So speaking of the future, where do we go from here? What's on the horizon for vancomycin and the fight against these bacterial infections?
That is the million-dollar question.
Yeah.
Like we've already talked about, antibiotic resistance is a major hurdle.
Right.
And we really need a multi-pronged approach to tackle it. This includes responsible antibiotic stewardship, stricter infection control measures, and really a relentless pursuit of new treatment strategies.
So that's a call to action for scientists, healthcare professionals, and even the public, I think.
Absolutely. We all have a role to play in this. So for scientists, it's about really pushing the boundaries of research, exploring new antibiotics, developing alternative therapies like phage therapy, using viruses to target bacteria, or antimicrobial peptides, which are small proteins with antimicrobial activity.
Those sound really promising. It's fascinating to think that the solution could lie in nature itself, whether it's harnessing the power of these viruses or leveraging the body's own defense mechanisms.
It's exciting, you know? It's a really exciting frontier. And then for the healthcare professionals, it's about promoting judicious antibiotic use, prescribing them only when absolutely necessary and making sure the patients really understand the importance of completing that full course of treatment.
Right. Well, for the public, what about the public?
For the public, it's about being informed, understanding those risks of antibiotic resistance, and advocating for those responsible antibiotic practices. Even those simple things like good hand hygiene, that can make a big difference.
So it really is this collective effort, this global village taking on these microscopic foes.
Exactly. We need to work together if we want to preserve the effectiveness of antibiotics like vancomycin for generations to come.
Well said. As we wrap up our vancomycin deep dive, is there a final takeaway message that you would like to leave our listeners with?
I think the key is to stay curious, stay informed, and never, ever underestimate the power of knowledge.
Okay.
The more we understand about these antibiotics, bacteria, and really the complexities of infectious diseases, the better equipped we will be to kind of navigate this ever-evolving landscape.
Beautifully put.
Yeah.
And that brings us to the end of our journey into the world of vancomycin.
Yes, it does.
It's been so fascinating.
It has been.
Full of insights, challenges,
Yes.
and a lot of glimmers of hope, too.
Absolutely.
And, as always, we encourage you to continue your own explorations.
Yes.
To ask questions, to seek out that knowledge,
Yes.
and be an advocate for your own health.
Absolutely.
Pharmacating, everyone. Stay curious, stay informed,
Yes.
and stay healthy.